Good afternoon, we are Group 3, and we are about to discuss medication administration via intravenous route. So, intravenous route delivers fluid directly into the vein, and it is the fastest way to deliver medication and fluid replacement throughout the body because they are introduced directly into the circulation. It may be used for fluid volume replacement to correct the electrolyte imbalances, to deliver medications, and for blood transfusion. For the 10 rights of drug administration, number 1 is right drug. So we need to check and verify if it is the right name and form. Next is the right patient. We're going to ask the name of the client or the patient. And also, even if you know that patient's name, you still need to ask just to verify. Next is the right dose. Also, be aware of the difference between an adult and pediatric dose. Next is right route. Also, kailangan natin maging familiar with IV, subcutaneous, intramuscular injections, and oral. And also right time and frequency. So we need to check if when was the last time it was given. And then next is the right documentation. So make sure that we write the time and the remarks on the chart correctly, and then write history and assessment. So also we need to check for the drug interactions and allergies of our patient. And then next is the drug approach and right to refuse. So with that, we need to give our client enough autonomy to refuse the medication after thoroughly explaining the effects. Next is the right drug interaction and evaluation. So review of medication previously given or the diet of the patient that can yield a bad interaction to the drug to be given. So also check also the expiration date and the medication being given. Then lastly, we need to educate our patients and we need to give enough information so that the patient is knowledgeable about the therapy or whatever drug he or she may be taking and the therapeutic and side effects of it.
Okay, so let's now proceed with the examples of intravenous administration. Standard IV lines are typically used for short-term needs, wherein a needle is usually inserted into a vein, where maybe it be in the wrist, in the elbow, or the back of the hand. The catheter is then pushed over the needle, and the needle is removed, and the catheter remains in the vein. All IV catheters are typically given in a hospital or clinic. A standard IV catheter is used for 2 kinds of IV medication administration. It can be IV bolus and IV drip. IV bolus is an IV push wherein it is a rapid injection of medication. A syringe is inserted into a catheter to quickly send a one-time dose of drug into the patient's bloodstream. An infusion is controlled administration of medication. When a doctor writes a prescription for an intravenous bolus, the amount of the drug is specified along the period of administration. The time required to deliver a bolus can range from a few seconds to as much as 30 minutes, depending on the volume of the medication being administered and other safety precautions. One goal may be to rapidly achieve a peak of the medication in the system, as seen in emergency situations. It may also be desirable to achieve quick results or because there is no other way to deliver the medication. So procedure for the IV bolus administration. So prepare all the materials, verify the patient's order of IV bolus administration, verify the patient, get his full name, birth date, and age, assess the patient's IV site, check for phlebitis or inflammation, inform the patient for possible side effects such as dizziness, nausea, and lightheadedness. Disinfect the site for IV bolus administration. IV push or bolus administration. Attach the luer lock adapter to the patient's site. Remove the protective plug, which is optional. Align red to red markings and connect. Administer the dose. Aspirate as needed to check blood for return. Depress the lever and disconnect. IV bolus administration.
Good morning. Today I will be demonstrating one of the applications of IV route administration, which is through IV bolus or IV push. So before administering, we need to disinfect the port of the IV line. Then we take our flushing solution to check for the patency of the line. So when flushing, we aspirate to check for backflow to make sure that the line is patent. And then we can proceed to slowly push to flush the line. If there is no resistance, and then it means that our line is patent. After flushing, we can then proceed to administer the medication. We administer the medication slowly. After administering the medication, we need to flush again the line. Make sure that the IV line is kinked so that the fluid does not go back to the IV line. After flushing, we have now successfully given our IV push. Thank you.
Central venous catheter, usually inserted by physician through the vein in the neck. The placement sites include the internal jugular vein, femoral vein, and the subclavian vein. IV infusions, controlled administration of medications into your bloodstream over time. Two methods, pump infusions and drip infusions. Pump infusions, most common method used, the pump is attached to your IV line and sends medication and a solution, such as sterile saline, into your catheter in a slow, steady manner. Pumps may be used when the medication dosage must be precise and controlled. It can be seen with the ICU patients. Drip infusions, it uses gravity to deliver a constant amount of medication over a set period of time. With the drip, the medication and the solution drip from a bag through the tube and into your catheter. It can be seen in our hospital-based settings now. Advantages of automated pumps: automatically change feeds, saves time, standardized procedures, reductions of error.
Now let's talk about the advantages and disadvantages of intravenous administration. Some advantages include the bioavailability, which is used to indicate the fractional extent to which a dose of drug reaches its site of action, or a biological fluid from which the drug has access to its site of action. It also includes a rapid action in emergency use and precise control of dose, in which it permits rapid effect and maximal degree of control over the circulating levels of drugs.
Next, it allows greater quantity to be administered. Lastly, no gastric irritation, wherein highly irritant drugs can be administered like anti-cancer. For the disadvantages, first, strict aseptic condition. The area where the drug will be administered must be cleaned first to get rid of microorganisms to avoid infection. Next, air embolism, also known as gas embolism. It is caused by one or more air or gas bubbles in the circulatory system when the air is accidentally injected into the veins.
Also, IV administration may be classified as high-risk medication, which may induce various complications. That's why it requires administration by a trained medical staff. Complications such as infiltration, where there's an infusion of fluid outside the intravascular space into the surrounding soft tissue. This is generally caused by poor placement of a needle or angiocath outside the vessel of lumen. Another disadvantage is phlebitis. This is the inflammation of the vein which occurs due to the pH of the agent being administered during the administration of IV, while thrombophlebitis refers to inflammation associated with a thrombus.
Clinical applications. Administration of volume expanders. Clinical applications. Useful in administering high-dose medications needed to be given in controlled amount over a period of time. Infusion of blood-based products. Administration of blood buffer in cases of alkalosis and acidosis. Used during emergencies needing immediate medications. Provide nutrition to patients who are unable of eating and digesting.
Good morning, I'm Mark Angel B. de Guzman, and I'm going to report about the drugs administered intravenously. So why are drugs administered intravenously? Drugs are administered intravenously because this route provides immediate onset of action. What drugs are administered intravenously? Chemotherapeutic drugs such as doxorubicin, vincristine, cisplatin, and paclitaxel are given intravenously since chemo drugs are easily absorbed through the bloodstream. Antibiotics such as vancomycin, meropenem, and gentamicin. Oral vancomycin works only for the intestines, while the intravenous vancomycin is used for treating peritonitis, endocarditis, and other infections. For gentamicin, it is the drug choice for the surgical prophylaxis. It is not administered orally because it is not absorbed in the gut. Antifungal drugs such as micafungin and amphotericin. Micafungin is not absorbed orally, that's why it is given intravenously. Amphotericin B is poorly absorbed from the GI. That is why it is given intravenously. However, oral amphotericin B is effective on the fungi within the lumen of the tract. The intravenous amphotericin B is given for the treatment of systemic diseases. However, it is not recommended unless the infection is life-threatening because it renders nephrotoxicity.